Thanks for choosing News Channel 11 at 5:30. I'm Josh Smith. Sarah will rejoin us in just a moment. We're continuing to await a briefing from the White House. President Trump and the coronavirus task force are set to update the public on what's happening in Washington. We'll go there live in a moment. Tonight, we're continuing to ask the experts questions about COVID-19 and the response here in the Tri-Cities. Joining us live via Skype now is Dr. David Kirschke. He is the medical director at the Northeast Regional Health Office. Dr. Kirschke, thank you for being here.
Yeah, thank you.
Thanks so much for your time today. Those numbers went up, as you have been saying they will go up. In your district today, we saw an increase in Greene County by 2 cases. We saw an increase, 1 case now in Hawkins County, according to those state numbers. What can you tell us about these new cases that were reported today?
Also, I'll just say overall, now there's 15 cases in the region. As you said, we've said that we expect numbers to go up. Currently, of the cases, 7 are associated with travel outside of our area. 5 are contacts to contacts. But really the new thing is that 3 of them, as we investigate, we're not finding any, known contacts or travel outside our area. So those cases are more an indication that there could be community spread going on in Northeast Tennessee.
Help me put that into perspective. From where I sit, that sounds significant, that for the first time you're now seeing 3 confirmed cases in the Northeast area that are not directly related to travel. Is that significant, and what does the public need to understand about what that means?
Yeah, so really that's what we've been looking for by doing all this testing, is evidence that there's community spread, so transmission going on in the community. So it's really, if people aren't doing it already, it's time to tighten up on all those public health recommendations we've been given. So people should do their best to avoid getting sick, keep themselves healthy, if not for their own sake, for the sake of people that are vulnerable in our communities, parents, the elderly, people with pre-existing conditions. We need to help protect them by keeping ourselves healthy.
Are those potential community spread cases in Greene County, or are they in Washington County or in Sullivan, those 3, or in Hawkins? Can you be more specific about where you're seeing it?
Well, not really, but I would just consider that there could potentially be community spread in any of our counties or all of our counties. So we do urge people to consider that as a possibility. So do everything you can to stay healthy, which includes limiting unnecessary trips outside the house, and all the social distancing measures we've talked about.
We're speaking with Dr. David Kirschke live via Skype today. Thank you so much for your time. Let me ask you about the people who have COVID-19 right now. Are they we'd heard that they were isolated at home and were recovering. Many of them had symptoms that were very manageable outside of a hospital. Is that continuing to be the case, or are you seeing any of the cases in our area needing hospitalization?
Yeah, so we don't have any current cases that are hospitalized because of coronavirus 19 currently.
That's good news, and we're glad to hear of that. And are you seeing any that have recovered? I know that's also part of the tracking, that you're tracking whether or not they're coming out of this and recovering, or are they all still undergoing the condition?
Yeah, so everyone's still convalescing. We do have people that are feeling better, but currently everyone's still in isolation. The reason that everyone's so healthy most likely is that we don't really have any cases in, either someone that's in the vulnerable population or in the elderly yet. So again, that's the reason we all need to try to keep ourselves healthy, is to keep coronavirus away from those people that are most at risk for severe illness.
Absolutely. And that leads me to something the governor said today and his address from Nashville, and that is that Tennessee, he said, is seeing a disproportionately high number of people in their 20s, that 21 to 30 age range. He called them young people who are being diagnosed with COVID-19. As a medical professional, how are you reading that? What are you seeing that's happening, and are we seeing that mirroring here in the Tri-Cities?
Yeah, so, across the state, obviously young people, a lot of them have been on spring break if they're college students and have traveled to other places where they're likely to come in contact with coronavirus more so than here. So we really do urge everybody, even if you don't think you're personally at risk, we know there is severe illness in every age group, including deaths. So we do urge everyone, if you're not going to take care of yourself for your own sake, consider other people's health, and especially those that are most vulnerable from coronavirus.
Dr. Kirsch, we're hearing of reports of concern from people regarding large manufacturing facilities, call centers where people are continuing to work and be in large groups. Are you seeing any evidence of ongoing risky behavior? Are you hearing about it at the health department of ongoing risky behavior of people in large groups together and therefore potentially spreading that and other illnesses?
Yeah, so we do recommend that people obviously stay home when they're sick, and it's very important. We've said before that, the more important you think, or we think we are to our job, or the more important we think our job is, really the more important it is to stay home when you're sick, because if you do end up being sick and exposing other people, there's going to be a lot of people in your work that are going to have to stay home in quarantine, and it could shut down your whatever employer that you work for. Could shut down the business. So we do urge people to stay home when they're sick. We keep hearing about people going to work sick, and we think that really people should heed those pleas really now to stay home if you're sick.
We are monitoring news conferences that seem to be happening on the hour. One of them happened today in Sullivan County, where Alan Levine with Ballot Health made a comment, and I love your reaction to it. He said it seems that we could be at a tipping point in the race to slow the spread of COVID-19. That at that point where we go from no community spread to community spread, the extent to which this spreads rapidly depends a lot upon what happens in the next few days. Do you agree with that? And can you expand on why, in fact, we might just be at a critical phase?
Yeah, so we just talked about that we're starting to see community spread in our area, or see evidence of it. Potentially it could have been going on before we actually found out about it. Once there's community spread, there's really potential for coronavirus to increase exponentially. I think we've heard in New York City, they're talking about the numbers are doubling every 3 days. So if we don't want that to happen in our area, we have to take all the social distancing measures seriously. So in Tennessee, the governor has enacted orders that really are extraordinary, things we've never seen before: closing bars, closing restaurants, only allowing carry out or drive through, closing gyms, recommending not more than 10 people gather together. So these are pretty extraordinary measures, and also all the social distancing measures. All of these things work, but obviously they don't work if people don't follow them. So we really urge everyone to take seriously all of the measures we've talked about.
Dr. David Kirschke at the Northeast Regional Medical Office, to you and to all of your colleagues there who are working to keep us all healthy, thank you very much. We appreciate your time today via Skype.
All right, thank you.
Thank you.